My name is Jolene George. I am a Port Gamble-Sklallam tribal member and the director of our behavioral health services within the tribe. And I have with me our department's attorney. The two of us wrote the Title IV plan that we'll be talking about today, and we were happy that we came early enough to spend the week with you here, because we've learned a lot about some of the differences, but also I think are hopeful that we can provide you with some information that will be able to help you move forward. So this is the journey to our Title IV federal approval. It was a long process for us. A little bit of history of our tribe: we're very small. We're only about 1,300 acres. We're located on the Kitsap Peninsula in Washington State. We have a little over 1,300 enrolled members. About a third of them are children, and a little more than half live on our reservation. The rest most live within the counties surrounding us. We are a signatory of the Point-No-Point Treaty of 1855, and the tribe has retained all governmental authority. The government and reservation were formed as part of the 1934 Indian Reorganization Act. We operate our own Indian Child Welfare Program and have since the mid-1980s. We have an extensive family code that protects our children in need of care, and we have our own tribal court that handles all of our cases. So the reason that we started looking at 4E, probably 10 years ago, and started trying to prepare our services and our things around that, because we believe that all of our children have a right to their culture. It was always difficult for us to locate a placement for children who do not have relatives, a lot of times able to take on that extra financial burden of having another person to raise. And until 1998, a family could only receive additional funds for that if they had child support, or if they were on welfare or licensed by the state. So in 20 years, we only had 3 state-licensed foster homes on our reservation. We could not find relatives, so a lot of our kids were going off-res. Almost all of our kids were going off-res. The children that were being placed in our state-licensed homes were mostly non-native or other natives. So we started using tribal TANF to support our children. In 1998, we began a tribal TANF program, and the tribal ICW, which is under the same department for us, was able to help them secure tribal TANF for taking in their children. In 2001, just a few years after we started TANF, we changed our policy that a court-placed child could be considered a family of one, even if he or she was placed with their siblings. So those of you that know about TANF know that a sibling group is, you get a base rate. Ours is, currently it's, I think, $352 per child. It's like an additional $40 or $50 for the next child. So with our tribal TANF program, we count them as their own grant. So we pay the full amount for each child, and we do not require that they say they charge their children rent to receive their TANF. So it makes a big difference. It's still not enough, but instead of paying, for instance, like I said, a family of 3 would have only been $530. The tribe pays the $1,000 for these 3 children, so they get the rate for each child. Like I said, both programs for us are under the umbrella of social services. We're actually in the same building. So our Indian Child Welfare and TANF programs could coordinate fairly easily. Oftentimes could fill out the paperwork ahead of time and walk it right down the hall to make sure there wasn't a delay in payment. We use TANF to help pay for clothing vouchers, emergency child care, and sometimes food. So because we started using TANF to support the Indian Child Welfare Program, we did see impacts on our tribal TANF. It can be used to support foster children, but it's not an unlimited resource, and we quickly saw that we were headed for some financial problems if we didn't figure something out. Families had to move out of our service area or become licensed for us to save TANF dollars. Our caseloads were not going down. You can see we were rising. These are our child-only cases and our TANF cases. Again, we're a very small population, but that has benefits, and it also has some difficulties. One child can make a pretty significant difference in the percentages that we're talking about. We recognize that our children are not just citizens of the tribe, but that they are also citizens of the state, and that the state owes it to them to be providing them the same level of service. The federal law, ICWA, and state law allows for tribes to license their own foster homes. But unless it was a state-licensed home, the state refused to pay the maintenance payments for us. We then spoke with the Bureau, who refused maintenance payments unless the state couldn't pay it. The state would allow the tribe to become a private licensing agent, a child placing agency of the state, which means we use their standards and certify that the homes meet those standards, and the home is then issued a license from Washington State. That also meant, if we did that, that the state would have to investigate any of our CPS issues. They would come on the reservation, and our homes, the reason that we only had 3 homes licensed on the reservation is that they didn't want an outsider coming in to do those investigations, and we were capable of doing our own investigations for all of our child welfare matters, but for some reason we were not, in their eyes, capable of handling these investigations if they were state-licensed homes. So a big part of our process, too, is understanding how so many of the other programs overlap and enmesh with each other, especially when you're talking about child welfare with the realm of services that are involved. So we have a little bit about some of the other programs that we have within our department because they end up interfacing so much with each other. We started operating our own child support 4D program in April of 2002, and we were one of the original 9 tribes to operate the child support program under the interim regulations. We did not receive any of the startup money, and today we have approximately 450 cases. I think we're probably even higher than that now. We can establish paternity, child support. We enforce those orders. We also establish medical support, which you will, if you do not know already, will be most definitely doing if you're doing anything related to foster care. The child support program is based on achieving agreements between both parties. Our child support code is written as an agreement-based process, and the tribe does not go in and make recommendations on behalf of either parent. We do have a schedule that they go off of, but it is not the tribe pursuing the child support. It is an agreement-based process. Our program honors the Sklallam traditions of collaborative problem solving, which is why we do have our code written around the agreed order. All TANF and foster care cases all are referred to the program to establish support and enforce them. And we have an agreement with the state that any cases involving tribal members and their children will be referred back to the program first for establishment and enforcement. About a decade ago, the tribe began discussions with the state to determine Medicaid and Medicaid eligibility for tribal members. It wasn't until 2007 that those discussions between the state and the tribe kind of started to become a little more of a reality. The state had to apply for a waiver to FNS to allow the tribe to determine food stamp eligibility, which I was trying to think of how that how food stamp eligibility came into it, but I actually think it was the state. The tribe was only requesting to do Medicaid eligibility, but we did have some encouragement from the state to also do food stamp eligibility if we were going to go that route. And so they applied for the waiver to FNS to allow the tribe to determine food stamp eligibility, and we were granted that. So an intergovernmental agreement was signed in 2009, which started a 5-year pilot project for us, and we have been determining in our office Medicaid and food stamp eligibility. So we can determine eligibility on the spot. We can issue their cards right in our office. I can't stress to you enough how much of a service that is for our tribal members. It's about a 70-mile round trip to our local CSO office, which is where they would normally have to go for those types of services. And transportation is a big issue for us. We did not receive any funds to do this. The tribe recognized the benefit and cost saving that would happen for us in the end. So we moved forward doing this program and budgeted for 2 full-time employees to run the program. We went through months of pretty intense training to learn how to use the state systems. But now tribal members can apply for and receive basic food benefits and medical coverage right on the reservation. We serve all Native Americans in the zip code. And we actually will serve anyone that comes in our office. Sometimes we have to transfer them to the local office, but we can at least get their application processed for them and get a card issued if it's an emergency. Low-income families access food stamps now, medical and tribal TANF all at the same time. We have more people coming into the office applying for benefits because they're more comfortable coming in applying for benefits to the tribal program. Families get medical coverage right away when they're coming to the tribal clinic, which lowers our costs because it goes back to the date of application. So with this, the tribe is eligible to receive match dollars. We get 50% match for Medicaid and 75% match for food stamps. We have an increased and faster access to Medicaid and food stamps for tribal members, and it helps our clinic get the encounter rate for Medicaid eligible visits that sometimes we were not able to do because people were still waiting or hadn't followed through with renewal certifications. So again, why is this part important to us? It's important because the more resources we have available to these people that are caring for our children, the more likely they are to be able to keep them for a longer period of time, right? So we have more people receiving food stamps. We have more people who are able to provide healthy food for the children. It provides that little extra benefit for them. It saves contract health dollars. Gosh, we're coming up on our 5th year. So I think our first year, though, our contract health dollars were saved like close to $100,000 for us. So it was a pretty significant savings. And the biggest thing is that it gives us the opportunity to help tribal members get a medical child support order before the state issues one, because now we know the second someone's eligible for Medicaid or goes on to Medicaid. And so you've heard a little bit about Title IV-B. Many of you, I think, are receiving Title IV-B more than we are. We only get one part of it. Our numbers aren't big enough. So we were approved for Title IV-B funds in 2001 and added the Chafee education and training voucher programs in 2010, which actually made us receive less money going direct. Fortunately for us, we have a great relationship with our state, and our state agreed to continue providing us the difference in the funding amount that we were receiving so that we didn't have a decrease there. It's just a picture of one of our beaches. So our staff began drafting licensing standards. We used ICWA and Washington State as a model. And I meant to add this in here. We started our licensing process or drafting our standards through a SEDS grant through ANA. It was a 3-year project for us, and we would not have been able to do that without the additional grant funds. I wrote our licensing standards, and at the time was a child welfare caseworker with a more than full caseload trying to write the standards. And I assure you that those of us who have been working on this would have done whatever we had to do, put in as many hours as we had to do to make these things come to life, because it's something that was important to all of us to move forward with. So it would have happened, but it made it a whole lot easier for me to be able to stop, for us to basically fill my position as a caseworker and let me move over and just focus on the foster care program. We had a citizens committee made up of different tribal members within the community, lots of different ages, and made sure they were consistent with the S'Klallam Way. We spent a long time interviewing tribal members that had gone through the system, grandparents, aunties, kids that have aged out, talking to them about their experiences, trying to learn, pull things from them that were important. We had our attorney review the 4E laws, ICWA, tribal code, to ensure that we complied with everything. And had our standards approved by tribal council. We actually skipped, so at this point, even though we have a good relationship with our state, they really weren't quite sure how to make all this happen. And so we had several meetings with them that we didn't have the right people at the table. And so we'd show up to a meeting and the decision makers that we needed were not present and we couldn't move forward. So those meetings would stop, and we at some point decided we were just going to send our standards to Region 10, to ACF, and have them go through them for 4E compliance, which we did. And we then submitted them to Washington State and said, well, we've already had the feds review them, and they said they met the 4E compliance, so this is how we're going to do this. In a matter of less than 3 months, we had an agreement signed with the state of Washington to license our own foster homes. It happened very quickly once we had the right people there. So we negotiated using a standard of foster home licensing equal to or exceeding the state. We haven't actually made any significant, I think we had one update to them with the Adam Walsh Act, but we haven't had to make any updates to those specifically since we wrote them. We use standards based on state and federal laws, not just state WACs. And in December of 2004, we signed our operational agreement with the state of Washington. In our state, we're able to determine our own licensing area. For us, just because we have a small area and not many resources available, we kept ours within our IHS service boundary, which is just within the county that we're in. We are looking to extend that a bit to some of the local tribes next to us that we'd like to partner with. So in 2003, we began discussions with Washington State to develop our 4E agreement. And in 2005, we signed our first tribal state 4E agreement and began claiming some of our children. Our staff worked with the DCFS state staff to correct existing data. We had a lot of errors in the state system. Some of our kids were not marked Port Gamble. Some of them had the wrong dates. There was lots of errors, and we weren't aware of them because we didn't have access to the state system at that point. So we literally sat with lists and went through each child one at a time and made sure their information was correct. We also were drafting our child welfare practice manual, which prior to this was all oral. It was a lot longer process than I think our attorneys had hoped. As I said, we were interviewing all these tribal members and people that had had experiences through our system, and we were pulling things from them that were bringing us back to lots of different areas and services and programs. So it wasn't just affecting our child welfare program, it was affecting some of the services and the way we do things with a lot of our programs. So it took a long time for us to get an actual written manual, but it's something we're really proud of. It not only has the policy and practice that we want them to do, but it also has what we call a service tip in there. That is an actual direct quote from a tribal member as to why we do things that way. In 2008, we started drafting the 4E plan and really monitoring the legislation. I can't stress to you enough how important visits to DC are. Every time we go to DC for anything, we make sure we make our rounds visiting all of our partners everywhere. Legislature, any of our federal officials through ACF and HHS, we make sure we make our rounds. In 2009, 3 years later, we had our council approve our practice manual for our child welfare program. And then we also unsuccessfully applied for the first round of the Title 4E planning grants. As I said, many of us on staff at that point really wanted to make this happen. We had been doing so much prep work for so many years that we were going to make this happen whether we had a planning grant or not. And I think for us it was a better route to go. We didn't have the pressure of the time constraints of the planning grant. It was difficult. I will say it's difficult. Andrea was trying to draft the plan as she's continuing to do the other work within the department. So it was extremely time consuming, but it was a priority for us and we made it work. 2009 and 2010 was a year filled with countless meetings and teleconferences with the state and federal partners. The federal partners in our region that were hired for Title IV-E had very little knowledge about Title IV-E or about tribal governments, so we spent a lot of time educating them about how our government worked, how policies were passed, how the code was written. And then in 2009, our state actually started assisting us more with training of our staff on how to determine eligibilities. We sent people to job shadow. They worked with us step by step through that process so that our staff knew how to handle this on their own when we got to that point. So we spent a couple of years kind of getting our staff ready, and fortunately we don't have a lot of turnover in our child welfare staff, so we've had a pretty strong group of people with us the whole time. And then in 2010 we submitted our first complete draft of the preprint, and we're told we would have to resubmit it in a new format. We submitted our original preprint before the tribal preprint came out, so it got sent back to us asking us for a new format, and then took quite a while for us to negotiate. So, but it did bring a new beginning for us. In 2010, we resubmitted our preprint to Region 10, and we began meeting at least twice a month, usually more than that, to go over the plan. And initially, we were kind of jumping around throughout the plan as we were going through, trying to answer their questions, making sure things were in the right spot. And you know, I know that the regional office would tell you that it's not something that you negotiate, but we will say that we negotiated our whole agreement, step by step, section by section. And there were a lot of barriers that we'll talk about at the end. And it was a very testing and trying process for us, but it is worth it. We were very careful not to create or modify our tribal code if something could be handled by policy. And for us, we made one very, very small code change, and that's it for our 4E plan. We gave a lesson to our federal partners on how the PGST government operation worked and what the approval process was for even a policy. We talked at length about language differences. Language differences were our biggest hang-up through the plan. Their idea of guardianship, our idea of guardianship are different things. We don't use the word permanency in our tribal code at all, and we were not willing to do that. So there were a lot of differences that we had to work out and things that we had to teach each other. And then we had to spend a lot of time explaining the current tribal state agreement, because in our region they didn't even understand how our tribal state agreement was working and how it was going to work, because again, I mentioned we have a good relationship with Washington State, and in essence we kind of flip-flopped our agreement, so we're their middleman now instead of them being our middleman. So our state continues to pay our foster care maintenance payments for our children, and instead of them giving us a portion back, we give them a portion back for some of the claiming that they do for us. So some of the barriers, and Andrea will go into more about the preprint part of it and some of these barriers here, but the language differences, as I said, were the biggest one for us. A lack of understanding, complete lack of understanding of tribal government. For us, really not including the state in our earlier discussions was something that we really should have done, because the state could have really helped explain to the feds some of the things that they were struggling with, and could have probably sped up the process significantly. We had a lot of past due payments from our state for maintenance payments. Figuring that out afterwards was kind of a nightmare. I'm not sure that we still really figured out the total amount that we are due, but we wanted to make sure they paid up on all of that before we went into a new agreement. Lack of access to the state's data collection system. We do have access now. It's limited, and we're not sure how helpful it actually is for us. The lack of grant funds to support our costs. Our penetration rate actually went down even though we had the same kids. We're still kind of puzzled by that one, trying to figure that out. I think the feds are a little bit puzzled by that too, but so we're working pretty closely with our region and the state right now to make sure things are being calculated and that they were being calculated the right way the whole time. And then for us, right now we're working on how we're going to be collecting and reporting our AFCAR data. So that's just a real quick overview of our PowerPoint. I'm sure everybody has lots of questions. We usually spend a pretty significant amount of time talking about the more technical details about 4E, but I will let Andrea talk a little bit about the process involved.
And I'll try and keep it short because it was a long process. It felt longer sometimes but you all know how that works already. Yeah, we had to submit the plan a couple of times. A couple of times they told us they weren't ready for us. That's Region 10. When the law passed in 2008, there's a little clause in there that says once you have an approved plan, you can start getting funding in 2009. So that's when I started looking at the law and figuring out, kind of strategizing what we were probably going to have to talk about with the feds, negotiate. It was not quite. It was important for the tribe to be able to continue the practice of taking care of their children the way they had always done it. And we weren't going to change anything that was going to jeopardize that. So a huge part of the negotiation really was all about language. Best interest of the child, best interest of the children is something that's not actually in our code except in one section where you use it in conjunction with the best interest of the tribe as well. Our definition of extended family includes aunties, uncles, community members, anybody who's got any kind of link or tie to the child. The tribe is family in our code. We never changed any of that. We follow the practice that's in our child welfare manual. You heard a little bit, Jolene told you a little bit about what kind of process went into putting that manual together, and we make sure that that happens in practice now. The only thing that's changed, honestly, is a lot of our court documents to make sure that we have some of the federal language in it that we need to have. In one of our initial meetings with Children's Bureau, I'm going to tell you this story just so you get a little bit of a snapshot. I always had to think of it that way when I was getting frustrated with our negotiations. So there were a group of us that went to one of the HHS tribal consultations. We do that all the time. You got to go to DC. And we had set up a meeting with Head Start, and we'd set up a meeting with Children's Bureau. Our first meeting was with Head Start, so if you've been to DC before, you go into that one building with the address, and then they walk you got to give them your driver's license, and you sign in, and they walk you through all of the machines, and then somebody escorts you up the stairs to wherever your building is, or wherever the meeting room is going to be. So I have my tribal chairman with me, I have a couple different directors, and I have another tribal council person, so there's quite a few of us. We go up to meet Head Start, we sit down in this one little waiting room, wait a little while, she takes us into this one waiting room, we have a really short 5-minute meeting, they ask us what we're doing afterwards, we say, yeah, we have another meeting, and they go, oh, okay, that's cool. We walk back down the stairs, we walk around the corner outside to the different address. We do the same process all over again, walk through all of the electronic equipment, sign in, give them get another name tag. And they walk us back up to the exact same waiting room so that we can meet with Children's Bureau in the conference room across the hall from where we just were. Welcome to negotiating your 4E agreement. So I always had to keep that in mind because honestly, they probably didn't talk to each other within those two services as well. For us, we have all of our services in one building. So Title IV of the Social Security Act, you have all of these social services. Title IV-A is TANF. Title IV-B is child welfare. I don't know what Title IV-C is. I think it's been repealed. I don't know what it was before. Title IV-D is child support, and Title IV-E is your foster care and adoption. When we were able to get Title IV-E directly, it was kind of a no-brainer for our tribe because we already did all the rest of it. So that was the last service that we really didn't have, at least out of Title IV. So as an issue and matter of exercising tribal sovereignty, there wasn't a question for us what we were going to do. And I did, and we all did, spend a lot of time arguing about what permanency really meant. I asked the question in that first meeting that I just told you about whether they had a problem with us following case management or practices that the federal law requires versus using the language that they use in those particular laws. And we were told, well, no, you can use your own language as long as the practice is fine. So that was the rest of it. That was the next 2.5 years. Oh yeah, but that's about practice, right? I don't need to use that word, right? The Region 10 had to come back and think about that a lot, but they did. It was really good to work with them. Honestly, they were very helpful. They tried really hard to understand. We really did, though, at the very beginning, when it was so frustrating, make sure we took an entire day, invited them to the tribe, fed them, gave them a tour, walked them through how our tribal government works, and I have to say it worked much easier after that, because then we could always go back and say, oh yeah, okay. So I know you're saying we need to write down in a policy manual that we're actually going to walk across the hall when a problem comes up, and you even have met the person that we would probably go to in the child support department, but you really want me to write that down in a manual? And they said yes. So we did. So we have a whole lot of different policy and procedural manuals that go over procedures that you would kind of normally do anyway. When a problem comes up with the family, you know you're going to talk to the next service provider. I mean, that's how you work child welfare, right? 4E ties all of that together. So 4E does really talk about how you can work with child support and how you can work with TANF and how you work with Medicaid. There's sections in that particular law that ties all of those services together. So it can seem a little overwhelming and it can seem a little bit of complicated, but at the end of the day, you are talking about your kids and somebody's life. So there's nothing more important than that. So if you have questions, let us know.
Just one other thing that I wanted to add is, you know, I mentioned how small our tribe was and how limited our resources were, but I just want to share that we've been able to claim anywhere from $60,000 to $90,000 each quarter through this process, and for us that at least pays for our foster home licensor and a bit of one of our time as well. So it has been extremely helpful for us, and we quite frankly wouldn't be able to provide the services that we provide without it.
Today we've been asked to talk about the Oglala Lakota practice model and the work that that guides us is based on a lot of thought from our community people who have expertise and knowledge and practice the ways, the traditional ways. And so I asked Richard Mooskamp to come today, and since he really is the voice of the people, in that he is practicing Wakaiyaska, that he has he grew up in these ways, and he has really, very in-depth knowledge of why we live the way we live, and why our values are what they are. And so I'd like to introduce Richard to my right, and then on my left here is Roxanne Tubles, who is the Family Support Specialist Case Manager. And in the work that we do, we have been guided by Peirre Richard in creating a practice model. We want to do the work in a way that reflects the values and the vision of the people. And so it began back in 2000, early 2000. There was a grassroots community group known as Oglala Oyate Iwichakyabi Okola Kiche, OOIO. And we began brainstorming how we would transform our child and family services system on the Pine Ridge Reservation. And what would it look like? What would be our vision? And how would we do the work? And at that time, we asked our families to help us in this process. And so the work that we do today is really, it comes from lots of prayer, ceremony, and talking with the people. And at the same time, it comes from looking at the best practices of how social work is done. And so we, as an agency, we look to being professional in our work and in our approach, and then we also utilize our culture as the foundation of our work. So I'd like to say just that much. I know we're really pressed for time, and I'd like to turn it over to Peirre. So after his presentation, we can answer more questions. Thank you.
Good morning. Lämpötycker sen työstä vet tjusan på dem idag. Teater man kan ska kunna han kan verkligen det samtidigt också det var I want to say good morning to my relatives, and really honored to be invited here to participate and listen to the latest concerns and issues that face our people. One of the positive things about some of the horrible stories that we hear about our relatives, our children being taken away. There was a relative of mine that was a product of foster home, a long time ago. He was taken from his home, and but for him it was lucky because he was adopted into a Lakota family, and he was a Lakota kid, so he learned the language really well, and he grew up a real traditional guy. So the positive part of that is, sometimes this model that we're going to talk about today, it's designed with all the relatives, all the council fires in mind. Lakota we chong ta ekta onkina jimanta takuni dokaktish. if we all go back to the traditional way of life and the gifts and the teachings that our ancestors have gifted us, we will be well ahead on taking care of our own. I don't think nobody from the outside will come and solve our problems that we face today, but it is our people. So a long time ago, we lived by some laws. Go ahead and click onto that. This training presentation was designed for the LOWO staff. I wanted to share it with the relatives today. But getting back to that relative of mine, when I talk about the hospital, he got sick, so he married a ICWA, white woman, and he was in the hospital, and we were all sitting around an emergency room. We were all praying for him, and my relative was. They took a lot of blood out of him with samples and tests, and the doctor came in there and says, called my relative's name, and he says, "You're going to be all right." He says, "I think you don't have a heart attack or you don't have anything serious." He says, "I think you're experiencing an anxiety." Well, some of us Lakotas, we don't really, that's a new word for us, anxiety. So he looked at me and I said, yeah, he's right. I said, yeah. So we were sitting there, and he had on a thing on, all hooked up, and the doctor put his chart by his bed and said, "We're going to go home today." So I was waiting for him to take him home, and here this nurse kept coming in there, slowly kind of taking things off of him. I heard him saying, "Nurse, nurse." So he called my relative's name. So, "What is it?" He said, "Before I go, could you find out something for me?" He says. We were all sitting around, and he says, "Are my testicles black?" He said. So that shocked everybody, we were all discovered. So anyway, the nurse kind of laughed him off and said, "Oh, this silly man, behave." He said, No, I want to know before I go. So the curtain went, and then I seen her putting on those gloves, and she went in there, and I heard him go, and then the nurse said, "They look pretty normal to me." So then he pulled his thing off, and he got up. He was really mad. He said, "I asked you if my test results are back." He was really mad, But some of us Lakotas, we have to really be clear on what we say. Anyway, just wanted to share that with you. Okay, we go on to that next one. A long time ago, when we put this practice model together, it was with our relatives in mind. Lakota Chawo Lanai. 7 prayers, 7 laws that we live by. And honey, one of my grandfathers, Joe Chips and Ellis Chips, their father's name was Harn Chips. We found an old recording of Ellis Harn Chips' father. And he talked about a lot of these that he wanted to share with the people back then. And I think that tape was recorded in 1930s or somewhere. But the laws that we make right here, the WOBCHE, if we put those back to our family structure, I think a lot of the children grow up healthy. What are the core values of the people? The people of Wichozani. Let's do with Wichozani. Wichozani means 4 things in our life. Hacha, Hawachi, Nagi, Nawaawachi. What is sacred to our people when we teach our children, when we tell our people not to hit our children? What is very vulnerable to our children today is Nasula. Nasula, the brain function, Hawachi. Wakanjaki, they really pick up everything. We train our people, we do our ceremonies so that they will be strong in these areas. Critical thinking, then we go on to the Next one. The hell, just talked about how we all should be living a good lifestyle, but for some reason, we don't take care of ourselves, so we get sick. And our feelings are really important. We heard testimonies. It was sad to see all the people who talked about the things that they went through, losing their children. The damage is done when we hurt people, when we go through these traumas and go through these experiences. It takes a lifetime to get beyond these situations that we encounter. Humbly. In our way of life, the beliefs that we have, sometimes we get into a point where we don't believe in anything anymore. We lose hope. We lose our people, our children, the things that our relatives have went through. So I'm just kind of going quickly because of the time. My friend sitting here, his stomach's growling right now. So, one of the old people said, the reason why we all go through these ceremonies is simply because our people have to live happy. A sad soul can kill you faster than a germ. So we go on, strengthening the families. The practice model is work to help families become strong again. One of the ceremonies that we use in our practice model in LOWO is the Hunkapi. That is the most powerful ceremony that the Lakota people have. All the 7 council fire relatives, what helps us survive as a nation is the Hunkapi. That is the main ceremony that Tiwahe, Otakwe, Luashakapi, honoring the relatives. The history of a child, the spirit of Lakota Wocheki, Wakanazaki, the people didn't have any somebody's always taking care of somebody, relatives. We lost a lot of these, so we feel alone sometimes. We always talk about the suicide rates, and the reason why a lot of our people have the high rate of suicide is because of the isolation, the isolated feeling that our people go through. Even though you're maybe surrounded by a lot of people every day, if your spirit feels isolated, then you're in real trouble there. So, Lakota Tawocheki, according to hardships, the sweat lodge was the very, very first ceremony that was ever given to the people. Then there was a ceremony called fireball, and then later in life, the Chanupa was brought to our people. I'm very proud of the tribe and all the people that are in here, and all the councils, and all the people that are servants of the Oyate, that they work really hard, and I'm really inspired by all the people that are doing something to help the people. And these are just some of the examples that I put on this board here. The practice model integrates the assessment, treatment, and we have several parts of this practice model. The sacred colors, and each colors and each area means something to our people at one time. The practice model is designed so that the main process of the practice model is called searching for relatives. With all the people put together, working with this practice model, I think nobody will be left out. There will always be a home for a child somewhere. There will always be a way to help our people. And that's through this process, this model that you're looking at here. So it's an old teaching that I found, and we were able to bring to to that agency so that they can use it for the people. The way that the temporary training our own people, building credibility, building sovereignty back into our families in TY. 7 fires that Oyate, LOWO, the LOWO is there to help rebuild that great nation again. I'm going to go into an area where probably need Emily's help to talk more about the processes of how they put this to practice, because they're the ones that stay there every day and they enforce this model here. So we do cultural assessments. We do come in there and run sweat lounges for the families and do ceremonies, do conduct home coffee ceremonies from time to time. But the ones that are really front line is Matunza and Mahanka there, that they're there every day. We're helping the people. The home coffee is one of the main foundations of the LOWO, and helping the mental health issues, and sometimes we go there to have ceremonies and so forth. The sweat lodge and the healing ceremonies that go through the trauma and the grief that people go through in losing their relatives. So the families that we serve, our foundation there is bringing the sweat lodge to educate our people and putting the curriculum together so that our families can have a place to come to pray. Like the ancestors had a long time ago, they prayed for us to be here today, and not thinking we're the ancestors here today. All the people that are in here. If what you do now is what's going to happen in the future. So, just wanted to share these teachings, and I'm pretty sure Emily and all this information is in the PowerPoint so that we can share and work together in the future. And there was a case scenario, but I'll just skip that part there. The teachings that there's 2 parts for that healing circle is the concept of utilizing this format here to provide good health and healing for the families. There's horse programs, and the north is the diets, and re-educating our people and how we should eat, and our diets, and the elk is, to help our people rebuild their self-esteem, rebuild our families back together, retraining and healing. A lot of damage is done to our people, but how we heal our people is where we're really having a struggle with that, bringing our people. Our relatives are in prisons, but when they come back, there's really nothing here in our reservations that put our people back through healing and training and rebuilding them to live in a healthy society, and we just sort of left them out there. So some of these visions are important that people can start working towards. And also the culturally based, the unique psychotherapy, utilizing our horses. I think some of the programs that are going on the reservations, I think I'm really thankful to hear that. Go ahead and go through all that. So these are some of the teachings that we have at what the practice models is. And I think I'll turn it over to Emily now, and she'll tell about how the administrative functions and how they enforce these practice models.
Thank you. That was a very brief, high-level description of what our practice model is about. So I wanted to share with you some of the ways that we provide services through our 4E process. And one of the things that makes us different from the state is that we do not do termination of parental rights. Also, I want to clarify that LOWO has jurisdiction over children on the reservation, and On-Track, which is our ICWA program, has jurisdiction off the reservation. So the children that we're talking about are the children that are that we serve on the reservation, and we through our structure, we have 3 funding sources. The first one is the South Dakota VSS Child Protection Services, and it's that agreement is a purchase of services agreement, and currently we get this year we get $879,000 to provide for staff of 15 people who are all referral, intake, investigators, and case managers. And then we have the 638 contract with the BIA, and that provides for children in kinship placement. And then we have the Casey Family Programs, where we have 9 children that we serve. And most of the referrals and investigations that come to us, we immediately work to assess them for 4E eligibility. So we'll put in for an application for them. In the meantime, we'll cover them through our 638 monies. So then when the state reviews the application and they become eligible, then they reimburse us back, and then we reimburse the BIA account. So currently we have about 40 children that are fully funded through 4E, and there can be many, many more. We have probably 20 more that the state is working on right this minute. And then in our investigation and referrals component, we have probably 100 or more that are being processed. So it's our numbers are fluctuating. Our mission is to preserve and reunify, preserve our children's rights to be with their families and to reunify them as quickly as possible. So we are, under our structure, we are more flexible. We're a lot more lenient than the state would ever have been or could have even thought about being. And so a lot of our families will come through our system, and our investigators will look at why the children were referred to us, and at that point, our agency, LOWO, decides whether the children can be returned or should be returned. And the cases that become 4E are those where children have been abandoned or severely abused or neglected, and where our tribal court places conditions on them. So we are able to provide for a wide range of services for our families. And all in all, we have, right now, currently in our system, we have 380 cases that are 4E kinship and going through the investigation process. So I guess the main thing that I would like to say about why we do the work that we do is that our people, way back in 2000 and before, felt that our tribe needed to exercise sovereignty over the care of our children. And so I do believe that we are an example of what other tribes can do. We're working very hard to meet the needs of our families, applying culture. Some of our children, and it has been voiced by youth through a child welfare needs assessment, have stated that they really want to learn about the culture, the traditions, the ceremonies, and yet their parents may not want them to learn about it. Or they have been so indoctrinated in Christianity that they view the ceremonies as being, being, I don't know, I can't really say, but as something very, very foreign. And so our social workers, when they're hired, they're asked if they would be willing to accompany a child to Inipi and to provide cultural education, and if they want to go through ceremony, that they be willing to go into the ceremony with them and to follow them through their service plan. And so we have made that a requirement. Also, because our nation has been devastated by alcohol and substance abuse, we require that our staff be alcohol and drug free. And this requirement came from the voice of the people, that we do the work in a different way. And we have, I guess in closing, we've been doing comprehensive child protection services since 2008, when we went into the tribal state agreement with the state. Prior to that, we were doing a lot of infrastructure building, capacity building, and that work alone is very, very, very time consuming, because you need to create your own codes to support the work. You need to have the community's voice, their vision for what kind of agency that they want to see, and there's a lot of work that that needs to happen. But like Port Gamble and our agency, we've had some experience in doing this, and we're happy to offer whatever services that we can to this effort. Also, one more thing, under our agreement, the Hunga ceremony is recognized, so that people can be provided guardianship assistance, but the state still requires that home be licensed. So we are really working at recruiting more families. And Richard talked to us in the very beginning of the creation of our practice model about how we are all, within Oceti Sakowin, we are all related. And we would like to be able to reach to our sister tribes to expand our family foster care world, I guess. And so he's talked to us about that. So I think today is a real dream for us, to be able to express that we can come together, we should come together, and it's very possible for us to take care of our children in our own way. I'd like to ask my coworker Roxanne to speak to any thoughts that she might have before we conclude. Thank you.
Thank you, Emily. My name is Roxanne Tubles. I'm the Tatanka Tioshpaye Red Shirt Table. I attended the summit, and I was really excited about LOWO and what LOWO could do to help the other tribes. One of the things that I want to say today is that this is a hard road. It's a long time. LOWO's been in existence a while, and working there, it feels like there's so much growth potential. It's in its infancy right now, and it's just beginning. There's new issues that arise, like today we're all sitting here. We're addressing some different issues that have been unaddressed for a long time. LOWO has taken that step to save our children, and I think it's an honor to be able to be here to help you and to show you how you can start and begin your journey with your own children. The funding, I'm really interested in the funding. We attended a meeting last night. We threw some ideas around, and there's some avenues that we can address to get funding beyond the Baucus bill. And I'm really excited about that. I'm also excited about recruiting foster homes on other reservations. That's excellent. We do have children some are in Rosebud or Standing Rock and Oglala, half and half. So we need to address that situation as well. Right now we have 30 licensed foster homes. We have also medical foster homes. And the reason we have medical foster homes is that there's a large number of prenatal alcohol consumption. So we have children that are born with medical deficiencies and FAS, or fetal alcohol spectrum disorder. So we have to address those things, and that's the reality of it. That's the reality of what's happening to our children now. And a lot of the times, the parents don't want to be compliant. Sometimes LOWO is a babysitter for them. If we remove their children from a home and their home and put them with kinship, then they'll say, oh good, well, we got 30 days, we don't need a babysitter, we can do whatever we want. So those are some of the odds that you're going to be facing in the development of your programs, and that's the reality of us. That's the true reality of Native people today. And I just wanted to express that, and I'm very thankful that we're here. Thank you.
Okay.